Hi, welcome to Edison Group Television. I'm Amanda Morrell. I'm joined this morning by Garth Sutherland. He's the CEO of Adherium. Welcome, Garth.
Hi.
So, can you just start by telling us a little bit about Adherium and the Smartinhaler platform that you've developed? Some really interesting technology here.
So Adherium is a digital health company, and we have developed a platform technology that helps drive patient adherence to medications used for the treatment of chronic disease. And our first leading application is called Smartinhaler. And Smartinhaler is a digital health solution for respiratory diseases for asthma and for COPD, chronic obstructive pulmonary disease. And they are two global chronic diseases, respiratory diseases, that affect about 500 million patients worldwide.
Wow, that's huge.
Yes.
So there's got to be some big implications here. What makes the Adherium story so interesting right now? I mean, the statistics themselves speak for themselves, but what's compelling about this story?
Well, if we look at, say, asthma and COPD as chronic diseases, we look at how patients use their medications. Patients underuse their preventative medications. They use between 1/3 and 1/2 of what's prescribed. And what that leads to is a significant burden from the disease on the patient, on the healthcare system, and on the global economies. So that's the key issue we're targeting, and our solution to that is to provide a digital layer of technology that sits on top of the drug and helps patients use their medications to gain better disease control. If we look at patients in, say, the G7, G8 markets, and we look at disease control, patients at best have between 40 and 50% of disease control. So patients in general are very poorly controlled with their chronic disease. So our digital health technology really helps address that issue, and through doing that we drive health outcomes for those patients, for the providers and for the payers.
So you've brought, beside perhaps a visual will be helpful, if you could just demonstrate or just show us quickly what this looks like.
Okay.
And how
So this is my own Smartinhaler. I have asthma myself. So this is a typical metered dose inhaler, and it comprises a piece of plastic and a canister. And the patient would typically use that, they'd shake it and use it, inhale it. But what it doesn't tell the patient is their usage patterns, and it doesn't remind them to take their preventative medication. So I'm an engineer by background and also a person with asthma, and I studied physics. And I put together this solution here. This is called the Smartinhaler, and this is an independent regulated medical device, and it has clearance to market in all the major markets around the world. And it simply attaches on the outside of the patient's inhaler, and now it converts that inhaler into a very sophisticated disease management solution. So the first thing it can do is tell me whether I've taken my medication today or not. If I forget to take it, it will remind me either through a light or through playing a little reminder tune. And the second thing is, once I've taken it, it automatically sends that information back to my smartphone, where I can see my medication usage just like that, right there and then. And that information can be shared with my parents if I'm a child, or it can be shared with my doctor. So my doctor has objective data on how I'm using my medications and can provide me with the right guidance and the right education, the right dosing to help me get my medication under control. The key benefit of this technology is it drives adherence to the preventative medication. In children with asthma, it's been proven to increase adherence by 180% in some studies, and it's been proven to return lung function to 100% of normal. Mm-hmm. It reduces rescue medication by 45% in those children, and it also dramatically improves child quality of life. If we look at adult asthma, we've shown, again in independent clinical studies, that this can reduce the number of severe exacerbations adults like me have with asthma, chronic persistent asthma, by 60%. And that is just phenomenal, because for a patient like me, each one of those exacerbations is life-threatening. So to be able to reduce those by 60% is a huge outcome for me. It's a huge reduction in the burden on the healthcare system in terms of unscheduled doctor's visits or hospitalisation, and as a result that saves money. And it does this through driving adherence to the preventative medication. So it's very simple, and it can be rolled out globally.
Simple but revolutionary, I imagine.
Yeah, because it's very revolutionary, because if we think about the history of medicines, medicines have been used for tens of thousands of years by people. This is the very first time that medicines are being combined we're combining the drug with the microprocessor, wireless communications technology, and the internet. And that is just a major transformation in the history of use of medicines. It's what we call the digitization of medicines. And it's providing all this data on how patients are using their medications. And we're proving, Adherium is one of the first digital health companies in the world to prove that we can drive outcomes through adding this digital tech to the drug. And in fact, our outcomes show that the change in health in the patient is far, far greater than providing another latest drug to the patient, because we're changing the patient behaviour in terms of how they use their drugs. That's a major transformation, and that's really only been recently enabled through the contemporary technologies that have been available the last couple of years.
Let's move to the financials for a moment. Can you tell me about some key milestones that you're looking at and some potential stock catalysts in, say, the next year or 2 years?
Yeah, sure thing. And I'll just position that amongst our recent history. So last year in July, we signed a 10-year global supply and development agreement with AstraZeneca, one of the world's leading drug companies in the respiratory marketplace. Very exciting agreement, very exciting company. And we're supplying them with devices under a global supply agreement to be distributed globally, and also supplying them with innovation. So there's a major milestone. On the back of that, we listed on the Australian Stock Exchange in August last year. And AstraZeneca participated in that investment, along with a lot of other long-term investors. And then on top of that, since we IPO'd, we have brought North American directors to our board. We've got clearance to market. We already had clearance to market in the US and in Europe. We've now added China. We've just added Canada last week. And going forward, we are signing up more major global supply agreements. So that's, our goal, now we've developed this fantastic technology, is to get it into the hands of patients. And we're doing that as a B2B company. So we're a service provider to the drug industry and to the global medical devices companies, to the hospitals, to the disease management companies, and also to the clinical trial sector. That's who we sell to. So we will see more of those agreements coming through. Right now we have about 63 programs running worldwide in over 30 countries, and that will just continue to grow. And also, we're a company that was founded in the Australasian region in New Zealand, but we are internationalising the company. We're establishing an office in North America and establishing an office in Europe, so we can provide more in-market support. That's what our short term looks like.
And what kind of competitors do you have working in this space, and does your approach differ from some of your peers?
Yeah, well, I think digital health is a very exciting area, probably the most exciting area in technology right now. So there is competition. If we just look at what's happened in the recent time, we kicked off the marketplace with a global agreement with AstraZeneca. And then we saw Teva, the large Israeli generics company, go and acquire a group called Gecko Health. So they could see that this technology was so important, they wanted to have it inside their organisation. And then we recently saw an agreement announced between Novartis and Qualcomm. So the market's really going digital. We are seeing the digitisation of medicines, and Adherium has been one of the primary founding companies in that space, and the only company really with significant health outcomes data, number one. Number two, the only company that's really working on an international basis with all the global approvals and a global go-to-market strategy. So those are our key differentiators from any other competition.
Well, fascinating story, a really interesting product. I'll be looking forward to seeing what the next chapter holds for you. Thank you very much for joining us. Garth Sutherland is CEO of Adherium. I'm Amanda Morrell with Edison Group Television. If you'd like to learn more about Adherium, please hop online to edisongroup.com. Thank you.